Okay, done. Hello, good afternoon, guys. Hope every one of you is doing well. How was the exam? I got very mixed reviews. Please write in the chat box. Those who are alive, those are alive, not alive. Hi, Sampu. Hi. Hello. So exam was a bit tough, not that, but moderate difficulty, moderate level, right? Chaliye, we'll start, right? Guys, remember the questions which we'll be doing over here. These are all just picked up based on the recalls what you have provided, but still we are not able to frame the question properly, right? Once the question is finalized, it will be uploaded in the PrepLadder app. Little tricky questions. Okay. Out of the box. Okay. Okay, guys, starting with the first question. According to the American Heart Association, what is the sixth link added to the chain of survival? I don't know this was the exact question or not, but we have recollected this one. Okay. American Heart Association link of survival. Guys, remember, according to the 2015 guidelines, just look over here. This was 2015 guidelines. This was 2015 guidelines. So according to the 2015 guidelines, we were having the first thing as, yes, this image was there. Okay. So the first one was recognition and activation of the emergency response system, high quality CPR, rapid defibrillation, basic and advanced emergency, yani ki basically the ambulance services. And the last one was advanced life support and post cardiac arrest care. That was according to 2015. But after 2020, one's last link of survival that was added to this was recovery. What was recovery? Okay? Recovery means it is rehabilitation, emotional recovery. Second, rehabilitation, emotional recovery, and neurological recovery. That was added according to the 2020 guidelines. These were added. So, recovery is a newly added according to the AHA guidelines of 2020 in the chain of survival. Okay. So, that was the first question. Coming to the second question. A patient was undergoing surgery, okay, was administered succinylcholine, a depolarizing muscle relaxant. Okay, shortly after administration, he develops hyperthermia, muscle rigidity, tremors, tachycardia. Basically, he has given you the diagnosis. Hyperthermia, muscle rigidity. Choline should provide you muscle relaxation, not muscle rigidity. But if you see muscle rigidity, hyperthermia, tremors, and tachycardia, your diagnosis should be this patient might be suffering with malignant hyperthermia. Malignant hyperthermia. So guys, remember, malignant hyperthermia is not it's not a new thing. Malignant hyperthermia you see in anesthesia and many times. Remember, the most common local anesthetic to cause malignant hyperthermia is lignocaine. Okay? The most common muscle relaxant. Basically, in muscle relaxant, only one muscle relaxant can cause malignant hyperthermia. That is succinylcholine, scoline. Okay? Apart from that, in anesthesia, inhalational agents can also cause malignant hyperthermia. Almost all inhalational agents can cause malignant hyperthermia, but the maximum incidence of malignant hyperthermia is seen with halothane. So those were some important points of malignant hyperthermia, guys. But what did he ask in the question? What is the most appropriate treatment for this condition? For malignant hyperthermia, as the patient is developing muscle rigidity and all, the best management could be giving a centrally acting muscle relaxant, that is Dantrolene sodium. Dantrolene sodium. Yes, answer is dantrolene sodium only, guys. Okay. Next, a patient is scheduled for elective hip surgery, is currently taking aspirin, multivitamin, enalapril, metoprolol. The surgery is planned in 5 days. What is the appropriate perioperative management for this patient? So basically, he's asking what medications has to be stopped and what should be continued. Okay. Now, an arrow was what is added. This image was this. Okay, okay. So look over here, guys. So what did you write about this? What did you mark about this, guys? What should be stopped before surgery? We have in our rapid review session also we have discussed what medication has to be stopped, what should be continue. I gave you a small mnemonic also for the medication that has to be stopped and that has to be continued before surgery. Okay. Basically, you continue aspirin, guys. Aspirin, you don't have to stop it. You need to continue aspirin unless and until patient is posted for neurosurgery or any retinal surgery. You continue aspirin. Normally, aspirin is given in a dose of 75 milligrams. It has to be continued. You stop metoprolol? No, sir. You don't stop metoprolol. Metoprolol is always continued only. Metoprolol is always continued. Beta blockers should be continued. Okay. Next, increase the aspirin dose. You don't increase the aspirin dose. What is basically done over here? You stop the ACE inhibitor and ARBs. Which is the ACE inhibitor and which is the ACE inhibitor over here? It is the enalapril. Enalapril has to be stopped. C कर दिया. नहीं भाई, metoprolol is not at all stopped. Beta blockers are always continued before surgery. They usually improve the outcome. Okay? Cardiac related events can be easily prevented. The heart failure can be prevented with beta blockers. We never advise the beta blockers should be stopped and all. Okay. So just brushing up, guys, what are the drugs which has to be stopped before surgery? I told you a small mnemonic for it. My clothes has to be removed. It's not my clothes. It's basically for the mnemonic. My clothes यानी कि M stands for monoamine oxidase inhibitor. Monoamine oxidase inhibitor has to be stopped 3 to 4 weeks prior surgery. C stands for clopidogrel. Sorry. Oh, very sorry, guys. Right. Clopidogrel has to be stopped 8 days prior surgery. Okay. Else say lithium has to be stopped at least 24 to 48 hours prior surgery. The reason why we are stopping lithium is basically lithium will prolong the effect of muscle relaxant. Oral hypoglycemic drugs are stopped on the day of surgery. TCA has to be stopped 3 weeks prior surgery. Okay. HCA, heparin has to be stopped 6 hours prior surgery, and warfarin has to be stopped at least 3 to 5 days prior surgery. SA, smoking has to be stopped. So these are the things that has to be stopped, right? Next, what are the drugs which are continued? We have discussed all active agents are always given. All active agents are always given. Now, guys, what all active agents? A stands for ACE inhibitors and ARBs. Sorry, A stands for antihypertensive. They can be safely given except of ACE inhibitor and ARBs. That has to be stopped. Okay. Next, anti-anginal medications has to be continued before surgery. Anti-anginal. Next, anti-cholesterol, or you can say lipid lowering drugs. They have to be continued before surgery. Okay. Next, anti-epileptic medications can be continued. Last, anti-thyroid or euthyroid medications can be continued. Anti-thyroid or euthyroid medications can be continued before surgery. Okay. Next, guys. A patient was undergoing general anesthesia. He develops left lung collapse. I don't know this was given or not, left lung collapse before following intubation. Okay. On auscultation, breath sounds are heard on the right side, right? Left lung collapse was given or not, I'm not sure about it. But patient was undergoing general anesthesia, endotracheal intubation was done. And after intubation, you just heard the breath sounds on the right side. What is the most likely cause of this condition? Okay. Okay, left lung collapse was not given. So we'll go with left lung collapse is not given. So now just look over here after intubation, only one side. Now, guys, remember, just look over here. This is the right side. This is the right lung. That's the left lung. Once you intubate the patient, okay, intubate the patient. Basically, when you intubate the patient, the tube should be 3 to 4 centimeters above the carina or 2 to 3 centimeters below the vocal cord. Okay, then only then only the air that you're giving will enter the right as well as left lung, and you will be auscultating the breath sounds equally. Now look over here, guys. Look over here. In our case, after doing the intubation, you were just able to auscultate the breath sounds in the right lung, not in the left side of the chest. What could be the cause? Now, going towards the options. First, we'll go towards the option, guys. The first option is endobronchial intubation. The second is mucus secretion. The third is pneumothorax. And the fourth is bronchospasm. First, we'll rule out the wrong options. Okay, the wrong options, absolutely wrong options are bronchospasm and pneumothorax. Sorry, the bronchospasm and mucus secretion. So look over here, guys. If there is any mucus secretion inside the tube, why will you hear the breath sounds only on the right side? You will hear diminished breath sounds on both the sides if there is any mucus secretion. If there is bronchospasm, you will hear wheeze, or you will auscultate wheeze. Okay, you will auscultate wheeze. It's not that you won't be able to auscultate one side properly. So bronchospasm and mucus plug is usually ruled out. Now, remember, one-sided you are able to see the breath sounds, other side is not. So basically, there could be two reasons for it. One could be the endobronchial intubation, and other could be pneumothorax. But other pneumothorax is very much less likely, guys. Why? Because for pneumothorax, you have to give positive pressure ventilation for a longer duration. You just intubated the patient. You just haven't started the positive pressure ventilation. Immediately after intubation, pneumothorax ke chances are very, very less. So the most probable answer for this, the most probable answer for this is what, guys? It is endobronchial intubation. What is endobronchial intubation? Endobronchial intubation means you have introduced an endotracheal tube, and your endotracheal tube you have introduced it, and you have advanced your endotracheal tube too much inside so that it has reached the right lung or right bronchus, and now you are able to see only the breath sounds in the right side of the chest. Okay. Right. So it is the right endobronchial intubation. Right. The options were different in this. What options were there? Can you guys just recollect what options could be there? It was not right endobronchial intubation. In the options, was there any endobronchial intubation? If endobronchial intubation was there, that was the answer, guys. Other options, okay. 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 Which of the following condition is not reversed with the administration of atropine? Guys, remember, atropine is an anticholinergic drug. What cannot be reversed with atropine? Remember, bradycardia, it is the first line of management. For bradycardia, you usually give atropine. Okay. For excessive salivation, you give atropine. Either you give atropine, or either you can give glycopyrrolate for excessive salivation. glycopyrrolate for excessive salivation. Okay. Bronchoconstriction, you can still give atropine. But for muscle weakness due to neuromuscular blocker, no, sir. Atropine is not given. Atropine is not given. Was this question there? I don't remember the question here. Okay. So muscle weakness due to neuromuscular blocker. Remember, guys, for neuromuscular blocker reversal, you are having a reversal agent. Reversal agents, again, you're having neostigmine, you're having pyridostigmine, you're having many, you're having neostigmine, you're having many reversal agents. Okay. Apart from that, you also have sugammadex. But remember, you might have remember that I told you if you're giving neostigmine to the patient for muscle relaxant reversal, what will happen is patient will have cholinergic side effects such as bradycardia. In order to counteract that bradycardia, we add either atropine or either glycopyrrolate, but they don't directly reverse the effect of muscle relaxant. Okay. So answer over here is what? Muscle weakness. Atropine will not reverse the effect of muscle weakness. Okay. Sir, a question was given behind the ear and swelling given on the neck. What question was given behind the ear? अच्छा, options were ptosis, meiosis, bradycardia, muscle weakness. Muscle weakness के लिए नहीं. अच्छा, rhinorrhea was also an option. Okay. Okay. Some anesthetic patch was given. Fentanyl patch. Most commonly, we are using fentanyl patch. So one question that one patient I think has or OP poisoning having symptoms like meiosis. What symptoms are similar even after giving atropine? I might mark rhinorrhea. Behind the ear, feeling anesthesia, and there was swelling on the neck. There was that was an image based. Sir, swelling neck given. What was that? Yes, image based swelling on the neck. Swelling on the neck means they were showing some vein that is dilated. Yes. Vein distension image asked about external jugular vein. What they asked about that? Did they ask? What was the question? They just gave an image, showed a vein, okay. And did they identify you? Did they ask you to identify what has been given, or did it tell you to identify the structure? What was the question? Okay, I'm still just frame your frame the options over here and the question. So basically, an image was given showing some structure in the neck. Okay, an image was given showing some structure in the neck. And what was like post anesthesia, post anesthetic patch that patient has developed that. Okay, that was given. Still not able to get your question. So get your question, guys. Okay, if that was given, it was external jugular vein, something. Okay, jugular vein. Okay. Jugular vein, if it was given, won't be giving you such simple question that identify what is the structure. They might have given you that we have like post anesthesia patient had developed a distension of that vein or something. If there is a distension of vein, basically external jugular was cannulated and patient had this cord-like vein appearing due to thrombophlebitis. That could be an option due to inflammation of the vein. That's not an anesthesia leave. Post anesthetic patch behind the auricle, post anesthetic patch behind the auricle, it is usually the fentanyl patch. Where it was a leprosy case. Okay. Thrombophlebitis was an option. If at all it is related to anesthesia, external jugular vein is seen that it might have been cannulated, and post cannulation, post removal of the cannula, the vein might have gone due to thrombophlebitis. It is appearing like like a cord-like structure. Okay. So, anyways, guys, I too found it very tricky this time. There were questions which came from our syllabus, but again, not the straightforward types. Okay. Anyways, you have given your best, guys. You have given your best. Now just hope that result comes outside. Now don't worry about the things, right? Take some days of rest, then start. If it or starting for NEET, PG, and God forbid if you need that for FMG once again. Okay. So anyways, yeah, question was tricky. There was a previously intubated patient. Anyways, guys, are you having my Instagram ID? If you are having my Instagram ID, please post those questions. I will try to reframe it properly. Ask because mention post anesthesia. Okay, okay, okay. Sure, 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 sure. Sure, you will reach. You have done your best. You will reach. Don't worry about it. Okay. So all the very best, guys. All the very best. Okay. If you're having, yeah. If you're having any more questions that you think that it might have come in the exam, please post in the PrepLadder group. It will come to me. I will just frame it. One question related to post anesthesia long time ET tube subglottic stenosis. The options were too similar. It was difficult to choose. Yeah, if the vein is dilated, if at all the question was about the external jugular vein being dilated and it is being visible. Remember, guys, the option there might be many reasons for external jugular vein to become dilated. Okay, heart related causes, many causes are there. Post anesthesia means basically post due to the cannulations and all, it might have got thrombophlebitis and it might have got dilated. Okay. So anyways, guys, some are telling it's totally a different case of leprosy and it's a greater auricular nerve. Anyways, so all the best, guys, all the best. You have given your best. Now enjoy, sit back and relax. Okay. Okay. Thank you, guys. Thank you.